Hair supplements are one of the most overused treatments, and most people use them completely wrong. And there's one mistake I most commonly see in my clinic wherein patients waste months on supplements. In this video, I'll talk about when supplements do actually work, when they do not work, and how I use them in my practice. Most people will think that hair supplements will stop the hair loss, but in reality, they don't. Supplements only correct the iron, B12, D3 or protein deficiencies. If the body does not need it, it cannot magically use it and reduce the hair loss. Here's the biggest mistake. I see many patients using supplements without a proper diagnosis. They take multiple supplements not knowing what they are actually deficient in. In my practice, I routinely evaluate patients before starting supplements. I generally check for ferritin, B12, D3 and thyroid levels. This helps me to treat the actual cause rather than prescribing routine supplements. Now here's something different that I follow. I follow something called as cyclical nutrition therapy. In this therapy, I don't give the same nutrition as a daily dosing. I split the nutrition supplement into multiple days. This also helps me to avoid two nutrients which do not interact properly. I've been using this approach for several years now and I have seen good results with this treatment. This helps to avoid unnecessary over-supplementation and keeps everything balanced. And in my practice, I generally tend to use supplements more in females compared to males. In males, generally the hormonal component is more, whereas in females, the nutritional component is more dominant. Supplements are not the main treatment for most hair loss condition. They only support the primary treatment, they don't replace it. Another mistake people make is depending only on supplements. Diet correction is equally important. Supplements without the proper diet will not give sustained results. Supplements are not meant to be taken blindly for life. They should be used in a defined period depending on your condition. So if you're facing hair loss issues, first get a proper diagnosis. Don't start random supplements by doing an online search. Get yourself evaluated and then start the right supplement for the right deficiencies. Hair supplements can help, but only if they are used properly at the right time for the right condition. Follow for more clear, honest, science-based hair advice.